Assalamu alaikum, Dr. Arshad Mahmood here. In this video, we will be discussing a very important topic in pediatrics, that is the anthropometry. That how we are going to take the anthropometric measurements as per the guidelines. So this is very important for pediatrician to have a good height, weight, and take a good way and as per recommendation of anthropometry. So the core elements of anthropometry are the height, weight, and head circumference, body mass index, body mass circumference to assess for adiposity, that is waist, hip, limbs, and skin fold thickness. So important that height, weight, head circumference, and body mass index. Routinely, this skin fold thickness is not being taken. So for measuring the height, weight, the first thing is that you should have a calibrated scale to the zero. Second is that scale should be placed on some firm surface and should be even surface. And third is that child should be wearing the minimum amount of the clothing and other items on it. So place the scale firmly on the floor, such as rather than on the carpet. Have the child or teen remove shoes and heavy clothing and sweaters. Have the child or teen stand with both feet in the center of scale. Record the weight. So in the center of scale. For infants, we use the small scales that are sensitive one, and we do not weight them on the scales used for the adults or children. So for them, the scale is used as shown in this video. This is sensitive scale, spring-based scale, and is can give readings very accurately. Another way of measuring the height in children that sometimes is used is that for the kids who are unable to stand, or when the smaller scale is not available, to first hide the kid with his some attendant, and then subtract the weight of attendant. So in this way you can also measure the weight of child. So this is also a measuring the weight of adult. Second is the OFC. For measuring OFC, you will use a non-stretchable tape, and head circumference should be measured using a narrow non-stretchable plastic or disposable tape. Clean tape with antiseptic wipes between the child use. Now measurement should be taken at the maximum occipitofrontal circumference, taking the largest of 3 consecutive measurements. So you have to take 3 measurements and take the largest one. Placement of tape is such that on the front it should be above the eyebrows, and then above the ear, and posteriorly you can place on any point that you have to take the maximum circumference. Third is the MOAC, that is mid upper arm circumference. For that, a tape is used as shown in this video. The tape has color coding from green to yellow to green. So green is the it is used basically in the age group of 5 from the 6 months to 6 to 60 months, and the color coding as shown in this picture, and it is for used for the wasting in the setting of some in the community setting. So the green line is showing the SAM, that is severe acute malnutrition. The yellow line is showing MAM, that is moderate acute malnutrition, and the green is normal. So since MOAC increases little between the age of 6 months and 5 years, it can be used in preschool children and age independent screening tool. So the important thing is that question is asked that why MOAC is fixed. So the mid upper arm circumference in this age group from the age of 6 months to the 60 months increases very little. In this age group, the fat is being changed into the muscle mass, so it remains constant. That is why it is a independent screening tool, that it is not dependent upon the age of child, gender of child, and it is used for measuring the malnutrition. So MAC less than 12.5 millimeters suggests malnutrition, and less than 11.5 again suggests severe acute malnutrition. Now the MAC is used mainly on the left arm. The reason being that is that tricep and bicep muscles developmentally may be asymmetrical, being greater in the dominant arm that is than in the non-dominant arm. So dominant arm is assumed to be the left. So protocol is to go for the left arm for measurement of MOAC. MOAC is currently not recommended for use among infants below age 6 months because the lack of data on its reliability, measurement in practice, and predictive value for the depth. So below 6 months we do not use the MOAC. This is again showing the red line, that is severe acute malnutrition, yellow that is moderate acute malnutrition, and green no acute malnutrition. So for measurement MOAC, first you have to measure the mid upper arm area from the olecranon process to the acromion. So first you measure the midpoint, and then you will measure the mosaic. This is showing the mosaic measurement. So pass the tape in between, and the boxes will be shown. You have to read between the this box, and these arrow are shown. As this, in this condition, it is following in the yellow line, so it is a case of moderate acute malnutrition. Next is the height, that how will you take the height and length. Before 2 years we take usually length, and also in the children who are unable to stand, like those with CP or some muscular diseases, we will also take the length. In other, we will take the height. So taking the length is done by the Anthropometer, which is having the mobile head side as well as the foot side. So you will place the infant, you will flex his knees, and you will also place the foot in vertical position, and you will press from both sides, on the head side and on the foot side, and you will then measure the length accordingly each child. So head should be also, and foot should also be touching the boards on each side, and the legs should be flexed properly and straight. Make sure legs are straight, arms at the side, and shoulders are at the level. Now, in taking the height of a child, we have to first remove the shoes. We have to remove some hairstyle if made, or something, cap or other things are there. We have to remove that. The child should stand straight, arms at the side, and shoulder should be at the level. And make sure the child or teen is looking straight ahead at the line of sight is parallel with floor. So he is looking at horizon and take the measurement while the child or teen stands with head, shoulder, buttock, and heel touching the flat surface. So this is exact picture showing that. So that the heel of child, the buttock of child, the back area of child, and the back of head all should touch the sportive wall or other sportive some rod behind the child, that should touching it. And on the feet, the shoes should be removed, and hair any hairstyle or hair bending should also be removed. Now the sitting length is another thing that is taken in this condition. You will ask the child to sit, and again in the same way a board is used on the head side, and a height is measured. So sitting base of the child is placed on erect as possible, with buttocks, shoulder, and head in contact with the backboard of the stereometer. Total height is measured. The height of sitting surface is then subtracted from the total height. This is important, that in short stature we usually take the upper to lower segment ratio. So in this way you can measure the upper segment. So first you take the height of child, then you take in this way upper segment, and then you can subtract this height from total height. That will give the height of lower segment. This is also the way for measuring the upper segment or crown lump length in those children who are unable to sit. So the head is positioned as with a length measured. The legs are raised so that the thighs are at the 90-degree angle to the board, and held in that position during the measurement. The sliding footboard is brought up against the buttocks with firm pressure, and reading is taken. Arm span, this is also taken in anthropometry. The arm span with accurate measurement should equally stature 1:1 if growth is normal. So if normal growth, child is having normal growth, then arm span with height should be equal. The arm span and height should be equal. Arm span measurement requires two people to complete measurements. The child extends both arms while the anthropometer or measuring rod is held across the back, extended from the tip of middle fingers to the other middle fingers. So first child will extend his both arms, and the height is taken from middle finger to other middle finger. This is incorrect technique. The photo shows the child is not able to extend his arm fully, so an inaccurate measurement would be taken. Therefore the arm span is not appropriate measurement for this child. This is figure is showing some ratio of upper to lower segment. If upper to lower segment is falling within this range, then it is proportionate short stature. If it is not, then it is disproportionate short stature. You have differentials for increased upper segment and lower segment, that can you read yourself. So I've just given an idea that at birth it is 1.57, at 3 year it is 1.3, and 6 year 1.1, 10 year 1, and adult it is 0.9. So this was a brief review of anthropometric measurements in the children. Thank you.